All right. All right. I want to welcome all of us now. We have a good quorum. So I would want us to now pray. And then after prayer, our presenter or our daktari is ready. Dr. Nderitu is a consultant ophthalmologist. I think that's the right term. An eye specialist. I also know that she's a retina surgeon. And we are glad to have you, Daktari, on board to talk to us about our eye care or eye health. And Dr. Nderitu is one of us from Unity District. So we are blessed to have one of us sharing with us. So we welcome you very much, Daktari. Let us pray so that we can start. Dear God, our loving Father, we thank you so much for giving us Daktari to take us through eye health. We ask that God Almighty, you guide us as we listen and as she shares with us. Help us even as we interact. And our prayer, oh God, is since you've given us such gracious gifts of eyes, I'll be able to make them healthy. We are thankful because of this time. And this we ask in Jesus' name. Amen. So karibu sana daktari.
Thank you, Reverend. Can you hear me?
Yes, I can hear you properly.
Okay, so welcome to this presentation on eye health. My name is Dr. Nderitu, as the Reverend has said. I am an eye specialist and a retina surgeon, so I'll try to give you an overview of eye health and still be done in 40 minutes. So it is said that the eyes are the windows to the soul. We don't know if it's true, but we know that having perfectly healthy eyes is crucial to your health. It's also known that looking into the eye shows a lot of diseases. There are a lot of diseases that show up in the eyes first before they show up anywhere else. So again, even as we say that eyes are the windows to the soul, they also show us a lot of problems that would otherwise have been missed, but they show up in the eyes. So many people start developing eye diseases in middle age, but a lot of times the diseases are silent, so you won't notice the symptoms until much later when the condition is very advanced and harder to treat. A lot of eye diseases are painless, so you won't feel any pain. It's not like a toothache that will take you to the dentist the next morning. A lot of blinding eye conditions are completely painless. So until it's very advanced, you won't know that you have an eye problem. And for this reason, it's very important to get your eyes checked, even if you don't feel like you have a problem, because you may have a problem that is advancing, and by the time you realize, it's very late. The risk for developing eye problems increases with age, and diseases like diabetes and hypertension can also increase your odds of having eye problems. However, if the problems are detected early and treated, nearly half of vision loss and blindness could be prevented. And this again emphasizes the importance of having your eyes checked. Even if you don't feel like you have a problem, get your eyes checked, even if it's just once in 5 years, because you may have a condition that's creeping up on you and you don't realize it. If you're diabetic or hypertensive, or for example, you're on treatment for rheumatoid arthritis, the medication used in rheumatoid arthritis, like hydroxychloroquine, can cause problems with your eyes. So if you have a chronic condition, you need to ask your doctor if you need to see an eye specialist. For sure, if you're diabetic or you're hypertensive or you have rheumatoid arthritis, it goes without saying that you need to see an eye specialist. Who are the eye health workers? Because there are a lot of people out here, all of them saying, Mimi ni daktari wa macho. So let's go through the recognized eye health workers and their categories. So an ophthalmologist like me is an eye specialist, a medical doctor who specializes in treating eye problems, medical, surgical, and optical. So they can treat a medical eye problem, they can do surgery, and they can dispense glasses. You go through 6 years of medical school as an undergraduate. You have to do your internship after that for 1 year. Then you can come back to school and do a master's of medicine in ophthalmology for 3 years. Then you practice under supervision for 2 years before you can call yourself a consultant ophthalmologist. This cadre of eye health workers. They tend to head eye hospitals and eye departments in hospitals, and they are registered and regulated by the Kenya Medical Practitioners and Dentists Council. So let's go to ophthalmic clinical officer. That's someone who's trained in KMTC. They do a diploma in clinical medicine for 3 years, then a higher diploma in ophthalmology for 1 year. They do most of the screening in eye facilities, and they're registered and regulated by the Kenya Clinical Officers Council. And we have optometrists and opticians. Optometrists prescribe and fit eyeglasses and contact lenses. Their qualifications are a diploma or a degree in optometry, and the diploma is KMTC. The degree would be like Masinde Muliro University. They're mostly based in optical shops, and they are registered and regulated by the Optometrists Association of Kenya. Opticians are technicians who are the ones who cut the glasses, the lenses, mostly certifications for this cadre. Again, they're mostly based in optical shops, and their regulation is not yet enacted in law as far as I know. It's still in the process of being enacted in law. So some of the common symptoms of eye diseases include blurriness, discharge, flashes of light or lightning, some patients see naona umeme, irritation, sensitivity to light, pain, tearing, and vision loss. So let's go through vision development, especially for the young parents, because this is really important. So between a birth and 12 months, an infant is very sensitive to bright light, especially before 3 months. So that's why they don't open their eyes, and their pupils tend to be very small because the muscles for dilating the pupil are not yet fully developed. So they can see things with their side vision. So if they want to see something, they don't look at it directly, they look away from it so that they can see it. So within a couple of weeks after birth, as the retinas develop, the pupils widen and they start seeing light and dark and patterns. Large shapes and bright colors attract their attention. And at about 1 month, the baby may start focusing on the mother's face briefly, and they may see brightly colored objects, but they're mostly interested in objects that are very, very close to them. An important note is that the retina develops fully after birth, towards the last trimester, and it completes development after birth. So if your babies are preterm, born before the due date of delivery, they need to see an ophthalmologist, because if they are born prematurely, they may develop something called retinopathy of prematurity, and this may cause them to go blind if it's not detected early. So any child born before their due date must be seen by an ophthalmologist immediately after birth, once they're stable, and even if they're still in the incubator, we are still able to see them. So for the first 2 months, babies' eyes don't follow each other very well. Sometimes they can get crossed, or the coordination is not very good. However, by the time they are about 5 months, the eyes should be moving together. However, eventually this behavior of one eye moving by itself should correct itself by the time the baby is 3-4 months. If one eye is always facing its own direction, either inwards to the nose or outwards to the ear, you need to talk to your pediatrician or see an eye specialist. By 2 to 3 months, the baby's eyes are following moving objects, and they may even try to reach out and hit a large object. And by 3 to 4 months, the eyes should be moving together and tracking a moving object. 5 to 8 months, they can see how far an object is from them, and they start reaching out to touch objects. They can also start developing depth perception. Depth perception means they can tell how far something is from them. Their color vision is also much better, but it's not quite as developed as an adult. By 5 to 8 months, they can recognize familiar faces and smile, and at this stage, they even start crawling, and this enhances their eye-hand coordination. As they reach out to crawl or to touch an object, then they're able to estimate how far it is. Blind children start developing challenges at this stage because they can't see where they are going, and so they need assistance. And that assistance is provided through ophthalmologists who will refer them to low vision specialists who will guide their parents on how to help a blind child go through their normal milestones like crawling and walking. So by 9 to 12 months, the baby is mobile, they are judging distances, they are running across the sitting room from one couch to another, they can see and judge distance well, they can grasp things, and they are moving around. So by 3 to 4 years, their eye-hand coordination is pretty good. They can hold crayons, they can hold plasticine, their fine motor skills are developing, they are going to school, they can copy shapes, and this is a good stage to buy them crayons and coloring books to help them with their eye-hand coordination. 4 to 6 years, their letter and object recognition is pretty good. They can do some basic reading, they can recognize numbers, they can name different types of money, and their eyes should be moving together all the time. If at this stage you notice your child's eyes are not moving together or one eye is looking in its own direction, you definitely need to bring them in to see an eye specialist. So this is I just put this image to try to explain depth perception. Someone with normal depth perception can tell that this man is standing a bit far behind this pair of shoes, and the shoes are in the foreground, the man is in the background, in the middle ground, and the house is in the background. If someone doesn't have depth perception, the man looks like his feet are in the shoes. So that's what depth perception is. So screen use for kids. With the advent of the digital era, harassed parents are giving their children their phones to entertain themselves for more and more hours each day. Screen use is not good for children at all, and the WHO guidelines suggest no screen time at all before 1, and if possible even before 3 years. That means minimum phone, in fact zero phone, and minimum television. Let the children go out and play, buy them toys, puzzles, plasticine, crayons. Minimize screen time for your children. That means computers, that means televisions, that means telephones. The generation that grew up in the 40s, 50s, 60s, 70s grew up perfectly fine without screens. Eliminate screen time for your children. Phones are an absolute no. iPads are an absolute no, absolutely, in children. Below 6 years, you need to absolutely minimize screen time. Let the child play. Common childhood visual problems, refractive errors are very common. This means the child can't see clearly, either they are short-sighted or they are long-sighted or they have astigmatism. Their vision is blurry, and this can be corrected with glasses. It's also possible to have 2 or more refractive errors at the same time. A child can be short-sighted and have astigmatism. They can be long-sighted and have astigmatism, and this interferes with school performance. A child is not likely to tell you they can't see clearly. This one you have to pick up yourself. Does your child move closer to objects? Do they move very close to objects when they want to see them? Does your child walk close to the television? Does your child bring their books very close to their face? Children will never tell you they can't see. You have to observe it yourself. And here I must commend teachers. They do a really good job of picking out children who have eye problems. So if a teacher, please visit your child's teacher regularly, because they're the ones who will tell you this child has an eye problem. Please let them see an eye specialist. Teachers are very good at this. Parents tend to neglect their children. They say, anapenda tu kuangalia TV akiwa karibu, or they like bringing things close to their face. If your child is bringing things close to their face, or they are moving close to see something, or you're walking home maybe from the car park and your child doesn't recognize you, you need to start asking yourself if your child has a refractive error. So children will never tell you that they can't see clearly. You have to pick it up yourself. Also keep an eye out for signs like head tilting. Your child tilts their head to one side or the other, blinking or squinting a lot, or they avoid reading. If they have lack of interest in activities that require them using their eyes extensively, or if they are reading out to you out loud, which is something you should do with your children, let them read out to you. If they keep losing their line, that should alert you that something is wrong. Or if you place something in front of them or they're looking at you, when you tell them look at me, or when you're talking to them, they are turning their heads to the side. That's a sign that there may be an eye problem. Something that is really important and can cost a child their life if it's not picked early is this white pupil reflex. And it's best seen on photography using a phone camera with a flash when in a dark room. If you see a white reflex in your child's pupil, it's possible that that is being caused by cancer or by cataract. And if it's cancer, if it's not picked up early, it can cost the child their life. So please be observant. There are parents who have picked this up just using their phones and the flash. So be observant when you're around your child. Squinting. This is the child squeezing their eyes, either to look at something that's close or to look at something that's far. This suggests that the child can't see clearly. So please don't shout at them, wacha kufinya macho. Please take them to an eye specialist. Refractive errors, which means short-sightedness or long-sightedness or astigmatism, can start at any age. I've met many parents who ignore their child squinting because they believe that watoto hawavaangi miwani. Miwani si ni ya wazee ama watu wazima. I've seen many children who need spectacles at 6 months, 8 months, 1 year, 1.5 years, 12, and they are glasses for babies. They actually exist. So if you see your child struggling, squinting, when you're across the room, they are not smiling at you, be observant. If you see like your child might not be seeing clearly, better safe than sorry. And these problems can start at any age. It doesn't mean that glasses can only be worn by children. They can be worn even by infants. So what is short-sightedness? Short-sighted means you can't see clearly far, you can only see near. That's why it's called short sight. You can only see short distances. So this image is supposed to help you see how someone who is short-sighted sees. The up there is how they see without glasses, and through the lenses is how they see with their glasses. So you can see how much of a difference it makes for someone who is short-sighted. These children are very comfortable looking at things that are near them, but they can't see far, and they tend to be disinterested in activities that are more than 3 or 4 feet away. And they're the children who tend to move very close to the television in homes where extensive television watching is permitted. They'll be watching the television with their nose plastered to the screen. That is a sign that the child can't see clearly. Please let them see an eye specialist. Then farsightedness means the child can see far but they can't see near. So you can see the image on the left, the person can see even round to the bend, but they can't see the dashboard. That's farsightedness. And a lot of children are slightly farsighted when they're in primary school. They tend to outgrow it in upper primary. So even if we see a child is farsighted, as long as it's a small error, we may not correct it. However, farsighted children tend to be disinterested in activities that are very close to them, within like a foot of their face. They don't like reading, and the way they present when they are older is headaches. They say they are always complaining about headaches because when they're in school, they are required to do a lot of reading. So when they are reading, the text is blurry and they really strain to read their books, not the blackboard, their books. So if your child is constantly complaining of headache, especially towards the evening, you need to bring them in for a checkup because they may be farsighted. Short-sighted children rarely have headaches. The ones who can see near but they can't see the blackboard, those ones tend to walk to the blackboard to see. So the teacher will tell you your child stands up and comes to the blackboard to see, but they hardly have headaches. Farsighted children tend to present with headaches when they are older. So if your child is always complaining of headache towards the end of the day, please let them get an eye checkup. In astigmatism, the images are distorted. So they can see far, they can see near, but both far and near images are distorted. And this is something that can be corrected with glasses. So the child will be telling you, I can't see clearly, but You can't understand why can't they, and it's near and far. Please bring them in for an eye checkup. Strabismus is when the eyes are misaligned. So like in this very beautiful baby, the eyes are looking towards the nose. The parents a lot of times don't pick this up early because it's both eyes. They think the eyes are just big. This baby will look at things on their right side with their left eye and look at things on the left side with the right eye. It's called cross fixation. So the right eye looks at things on the left and the left eye looks at things on the right. If your child's eyes seem curious or somebody tells you, I don't think your child's eyes are straight, please bring them in. And if you come to hospital, there are a lot of health workers who are not specialized in eyes. So the person you see sometimes in a hospital, even a pediatrician, may not be very clear on whether there's a problem or not. So even if they tell you to go home and you think there's a problem with your child's eyes, and whoever you come to hospital and see tells you there's nothing wrong with your child's eyes, please persist. Go to an eye hospital and get confirmation that all is well. Because the first person you meet may not know there's something wrong with your child's eyes. So that's another example of strabismus. The right eye is facing the nose, the left eye is looking straight. Another example of strabismus, the right eye is facing the ear, the left eye is looking straight. This is an example of a head tilt. So the child looks at you or talks to you with their head tilted all the time, consistently. This is a problem. It means the eyes are not aligned, and the child is trying to align the images that he's seeing by tilting his or her head. If you see your child is constantly tilting their head, please bring them in, because it means the brain is receiving distorted images and the child tries to correct those images by tilting their head. These children have both a head tilt and a face turn. So the head is tilted, and you can see in both pictures you can only see one ear because the child has turned the face. Again, the child is seeing distorted images because the eyes are not aligned. So as the child tries to align their eyes so that they can align the images, they tilt their head and turn their face. So if observe your child, when they are looking straight at you, can you see both ears? Is the head tilted? If there's consistency of you can only see one ear when they are looking at you, or the head is always tilted, then you need to bring them in for an eye checkup. So some tips to help your child's vision as they grow: buy them puzzles, buy them building blocks, buy them pegboards and toys, colorful toys, vehicles, dolls, get jewelry, stringing beads, large beads if the child is smaller, and keep an eye on them so that they don't put the beads in their ears and their nostrils. Get coloring books and crayons and colored pencils. Buy paint and sketch pads. Let them paint and draw. Play catch with them, and buy them colorful building blocks. This reduces how much time they spend on screens, and it helps them develop their vision and their fine and gross motor skills. It's also important to have regular eye screenings and exams as they grow up. It's also very important to let them play outside as much as possible. Studies have shown that children who spend their time playing outside rather than sitting indoors on phones and television have a lower risk of developing short-sightedness than children who are constantly on phones and iPads and screens. So encourage your children to play outdoors as much as possible. So enough of children, let's move to diabetic eye disease. Diabetic retinopathy refers to the changes that are seen in patients with diabetes on the retina. When we look inside a patient's eye, what you can see at the back, the blood vessels, that's what is called the retina. And that's a structure that sees. The eye is like an old camera, those old cameras that had films. The camera was just a box, and the film was what actually received the image. So your eye is actually just a box, and the retina is what receives the image, and it's what transmits the image to the brain. The retina is what is affected in diabetic eye disease. So that's a normal retina. You can see the nice blood vessels. The pink spot in the middle is what sees. That's what receives your sharpest vision. So you can see there's no blood anywhere. It's just blood vessels. The blood is inside the blood vessels. So when you have a non-proliferative diabetic retinopathy, This is what your retina looks like on the right, if I may point. So you can see that there's bleeding. There are hemorrhages. We call them hemorrhages. Small hemorrhages. This is reversible with good control. This is how a normal person sees this bunch of flowers. If you have early diabetic retinopathy, this is how you're likely to see the same bunch of flowers. However, early diabetic retinopathy is reversible with good control of your sugars, and if we see you early enough. And the way we pick this up is if you're diabetic, you need to see an eye specialist every year for your entire life, because you may not notice these changes. We will see these changes, but you will not notice them. So you need to come in for an eye checkup, even if you're not having any problem with your eyes, because these changes you may still be seeing normally, yet your eye is bleeding inside. So you need to come in even if you have no problem with your vision. So as it advances, this is how your retina looks. You can see there's much more blood. This is normal vision. This is more advanced diabetic retinopathy. You can see the vision is starting to drop. It may be reversible with urgent intervention by retina surgeons. Not always, but in a lot of cases, this is still reversible if caught early. So this is advanced diabetic eye disease. I'm sure you've all heard that diabetics can go blind. Diabetes can cause blindness. So this is what we see when we look in your eye. You can see the extensive bleeding. This is usually reversible, and there may be nothing we can do. By the time you start losing your vision, if you're a diabetic, this is how your eye looks inside, and there's not much we can do. You're basically going blind. So this is normal vision, and this is how this patient will see the same flower vase. Now, it's important to understand that in advanced diabetic eye disease, these kinds of patients, studies have shown that these kinds of patients with advanced diabetic eye disease, when a diabetic goes blind, their life expectancy is really reduced. A lot of diabetics who go blind die within 2 years of going blind. So it's really important as a diabetic, in order to achieve your normal life expectancy, that you have regular eye checkups. Because once you lose your vision, the likelihood that you will lose your life becomes very high. You can't measure your insulin. You can't tell which tablets you're taking. You're very dependent on other people. You injure your toes, you're more likely to have amputation. And patients with advanced diabetic eye disease also tend to have renal failure. So you're also going for diabetes. So as much as possible, if you're diabetic, get your eyes checked every year. By the time you start losing your vision, this is what your eyes look like, and you may never be able to regain your vision. Diabetic maculopathy is a condition that results from diabetic retinopathy at the center of your vision. Again, if you come early, when it's like this, it is reversible. When you come when it's this advanced, it may not be reversible. We move on to glaucoma, which is called the silent thief of sight. It's the second most common cause of blindness worldwide, and it's one of the leading causes of blindness for older people. Again, it is silent. It can occur at any age, but it tends to be in patients over 40. This one, you'll only notice it when it's quite advanced, and this is how it comes. The reason you'll not notice it is because it comes from the periphery. You lose your peripheral vision, or you develop blurry spots in your visual field. By the time you notice glaucoma, you're looking through a tunnel, and at this point, you're not far from going totally blind. So again, over 40, you definitely need an eye checkup at least once a year. So again, in glaucoma, you have progressive damage of the optic nerve. This is normal vision. This is a patient with glaucoma. Again, normal vision, a patient with glaucoma. You can see the darkness is coming from the sides. That is why it is noticed very late. If you don't get an eye checkup, you will never know that you have glaucoma until your vision is disappearing. And this condition tends to be very frequent in hypertensives, but it can occur in anybody. So you see, you will not notice that your vision is disappearing until it's almost totally gone. So the only way to know if you have glaucoma or not is to get an eye checkup. So we come to presbyopia. I'm sure many of you can relate to this gentleman. You start pushing books away, newspapers and Bibles. You read your newspaper at arm's length. You can barely make out the print on your phone, and you're struggling to read the print on your computer. Presbyopia is primarily an inevitable age-related condition. It's perfectly normal. It's not a disease. We call it physiological, which means it's part of aging. It's caused by loss of accommodative ability of the eye. What is accommodative ability of the eye? It's like it's like the zoom of your phone camera. The way you can zoom out, you can zoom for something close, zoom in on something close, and zoom out for something that's in the distance. You have that ability up to about 45 years, the ability to zoom in and out, to see things that are close and to see things that are far. After 45, you lose that zoom function. That's what we are calling the accommodative ability of the eye. So this manifests as gradual onset of blurred near vision. So other symptoms that you may experience, you're squinting, squeezing your eyes, you have headaches. For you to see something, you turn on your phone torch to read the menu in a restaurant. You need to push books and newspapers away, and your eyes are painful when you're exposed to outdoor light. The way to sort this problem is to just get a pair of reading glasses. It can be a separate pair of reading glasses. You can use contact lenses. You can use bifocals or progressive lenses. It's important to remember that you need to change your glasses, your reading glasses, every 4 to 5 years. After 4 to 5 years, you'll notice na hii miwani imeisha nguvu. It's not the glasses imeisha nguvu. It's your presbyopia that is progressing. Every 4 to 5 years, from when you start needing reading glasses up to about the age of 65, that's when your presbyopia will stabilize. And don't listen to the people who tell you to change your glasses every year. They're just looking for money. If you get the correct prescription, you should be able to comfortably use your glasses for at least 4 years before you need to change them. So this is just to differentiate for you progressive lenses. They have 3 segments: a distant segment, an intermediate segment, and a near segment. So a distant segment is for seeing far, like more than 5 feet away. An intermediate segment is like for when you're using the computer, and a near segment is like for 1 foot from your face when you're reading a book. So bifocals tend to only have distance and near. So if you're using a computer, you'll use the distance segment, and they tend to have a line in the middle. Progressives are the ones without a line in the middle. So digital eye strain is a group of eye and vision-related problems that result from prolonged usage of screens, computers, tablets, e-readers, cell phones, and it causes increased stress to near vision. The symptoms can be blurred vision, double vision, presbyopia, which we've just discussed, and you find that after you've been using your phone for long, when you look in the distance, you can't see clearly. It takes a while for you to see objects sharply. It may also manifest as eye strain, tired eyes, burning. Your eyes are burning. You feel like there's pepper in your eyes. They are dry. You feel like there's sand in your eyes, grittiness, redness, tearing, and irritation. The easiest way to avoid it is to make sure you blink often, and when you're using screens or doing close-up work, every 20 minutes you focus at least 20 feet away for 20 seconds. This is the 20-20-20 rule, and it lets your eyes relax and reset. Better yet, stand up, walk around, stretch your legs, look out the window to allow your eyes to relax for about 20 minutes. If you use reading glasses, make sure you always use them when you're using screens, computers, and electronic devices. So I think I've done my 40 minutes. Thank you very much for listening. Have a lovely evening.
Thank you very much, Dr. It's a great presentation. We are excited. Would want now to hand over to the members who have questions. You can either lift up your hand, we will see it and then invite you, or you write in the chat. I think I almost got tempted to say presbyopia is for Presbyterians, but because I find them taking Bibles away from themselves on a light touch. So please, anyone with a question you would want to ask, you can lift up your hand, or you can write a chat, or you can send us an SMS. Anyone with a question? Yes, Elder Gedenji.
Oh, thank you so much, Lev. Thank you for Dr. for a nice presentation. I have a question concerning vision. That when somebody is having a problem, the eye problem, and given glasses at an early age, and then after some time you see like you're seeing well and forget about the glasses, and now you see no more movement or life without consulting, as you say. Does it really improve your eyes, or we should just consult, although you may not wear glasses anymore? Thank you. That's my question.
Thank you for that question, Elder. I hope the sound is better now. Like I said, in early primary school, middle primary school, a lot of children have mild farsightedness, and so they may use glasses when they are in lower primary or upper primary, and when the farsightedness clears on its own, then they discard their glasses. So this may be one reason why a child particularly may discard their glasses. This doesn't happen in short-sighted patients. Short-sighted patients tend to be short-sighted for life. However, if you're middle-aged and you find that you're going off your glasses, then it would be important to see an eye specialist, because one of the ways that diabetic patients present is they were using reading glasses, and then all of a sudden they tell you, hey, siku hizi naweza kusoma. It's the diabetes that is causing them to be able to read like to read their Bibles, read their phones without glasses. Once we find out that they're diabetic and we correct their blood sugar and their eyes go back to normal, then they go back to needing their glasses. So if you find you used to use glasses and now you don't need them, please get your eyes checked. It is entirely possible that you have developed a problem like diabetes that is causing you to discard your glasses. So my advice is, if you find your vision has changed, you're discarding your glasses, get your eyes checked. Thank you.
Thank you, Daktari. Any more Isiolo Resort?
Yes, thank you very much for that good presentation. My question is there an alternative to glasses? Somebody told me you can have an operation, maybe to remove whatever is preventing from seeing far, and sometimes it is successful. So I'm asking, is there an alternative to glasses? Maybe the operational, like a procedure that can correct your eyes, and is it safe?
Thank you for the question. There are two types of surgery to correct vision. There's LASIK surgery that can correct short-sightedness or far-sightedness. It is safe, but you need to be assessed. Not everybody qualifies for the surgery, so you would actually need to be assessed to correct far-sightedness or nearsightedness. The age-related one, the presbyopia, that one requires cataract surgery. They remove your lens, even if it's clear, and they put in an artificial lens if you don't want to wear ile miwani ya wazee. So it's cosmetic surgery, and surgery comes with its own risks, which will be explained to you. But yes, there is that option. I'm seeing somebody asking, explain the ring of lighter color that forms around the dark part of the eye. That tends to be age-related, usually coming beyond 40, and it's fatty deposits. It comes in some people and not others, and it's harmless usually. Then tell us something about laser correction of eyesight. Like I said, LASIK, it's called LASIK. It can be used to correct long-sightedness or short-sightedness. Not everybody qualifies. You need to be assessed. There are two places that do it in Kenya. I think One is in Fifth Avenue, and the other one is in Sarit Center. And again, it's cosmetic surgery. All surgery has risks, and this would need to be explained to you before the procedure.
Dr. Kariri?
Good evening. Thank you, Dr. Nderitu, for the good presentation. My question was, what is a contact lens? What is its advantage compared to ordinary glasses? And lastly, how frequently is it removed from the eye? And are there chances of injuring the cornea as you remove and replace?
Okay, there are soft contact lenses and hard contact lenses. More commonly, soft contact lenses are used either for, you've seen younger people wearing colored contact lenses. They can also be used to correct a problem of short-sightedness or long-sightedness or astigmatism. Usually, you should wear your contact lenses for not more than 8 hours. Normal contact lenses. There are some extended wear contact lenses. They're called extended wear contact lenses. They're hydrogel, and they can be worn for up to 12 to 14 hours. And hard contact lenses are only for people with certain eye conditions like keratoconus. But soft contact lenses can be worn by anybody as long as your eyes they don't have a tendency to dryness and you have no infection or allergies. You need to wash your hands thoroughly before you insert the contact lens and before you remove it. And yes, it is possible to injure your eye while you're wearing it or removing it. You can also injure your eye if you wear it for too long, if you sleep in them, if you shower in them, and if you swim in them. In fact, those are the 3 S's. You're absolutely forbidden to swim in contact lenses, to shower in contact lenses, and to sleep in contact lenses. So there's a lot of care involved. We don't recommend them for very young children or children in boarding school or people living in places where they have challenges of clean running water. But if you don't have a problem with clean running water, you're a child of over 12 years, hygiene is not an issue. You need to change the fluid where the contact lens sits every night. And the bottle, you need to always have a bottle of clean and expired contact lens fluid. If you notice any problem with your eyes while you're using contact lenses, please see an eye specialist immediately. There are some specific infections that are very aggressive that come with contact lenses, especially if they are not used hygienically. So if you notice any problem when you're using your contact lens, please see an eye specialist immediately. I'm seeing gated contractors. Can taking vitamin A supplements correct eye problems in children above 5 years? No. The child should get adequate vitamin A in their diet, but it will not correct eye problems. No, it will not correct eye problems.
All right. Is Mr. Morodi still lifting up his hand or ni aliacha hapo? Joseph Ngugi? Joseph? Joseph, you can go.
Hello?
Yes.
Can I be heard?
Yes, you can.
Yeah, thanks for the good presentation, but maybe Dr. can mention about the diet, because the diet also improves the eyesight. Maybe she can recommend the diets.
It's very important to have a balanced diet for general health and even for your eye health. We know vitamin A is very important for the eyes, both for the retina and for the ocular surface where the tears are. But as long as you have a balanced diet, what it does is that it prevents you from getting certain eye diseases. Like children in orphanages who may not get enough vitamin D from not going outside, or enough vitamin A, can develop very, very severe problems with the surface of their eyes. But as long as you get enough of your green leafy vegetables, your vitamin A, the red fruits and vegetables, carrots, mangoes, pawpaws, You get your B vitamins from your green leafy vegetables. You get your C vitamins from citrus fruits. You get your D vitamins from eggs, fish oil, fish, and sunlight. Then you should be pretty okay. Yes, a balanced diet does prevent some particular eye problems. So if you have some deficiency, some nutrient deficiency, then you may be treated by supplementing that deficiency. But if the problem in your eyes is not coming from a nutritional deficiency, then supplements will not make any difference.
There's another one on the chat, Daktari, from Simon.
Someone is asking if you have ortho-K lenses available locally. That one, I think you have to inbox me. I find out for you. Some products that are not fast movers may be imported on order. So that one you might need to inbox me so that I find out if you can get them locally.
Thank you. I think there is no other question. We are excited, Daktari, for having you. Just to let us know that we are doing a partnership with Dr. Nderitu with our presbytery, so that she is able to visit our zones, like maybe come to Kahawa zone, deal with Wendani and Kahawa, Sukari, and then maybe go to Kahawa West and such. We're in that communication soon, where she'll be able to come and check our eyes and then advise us on what we should do. So very soon we'll be announcing that through the presbytery. Other than that, we are grateful for the presentation. It's a great joy to have you, Daktari.